I am Dr. J. Kumar, neurosurgeon and medical director at Medivisor India Treatment. Brain stroke, in layman's term, means sudden disruption of blood supply to the brain. Because of rising incidence of brain stroke in young, it is a matter of concern for all. Blood to the brain flows through various tubular channels called arteries, and it is pumped by the heart. When arteries get blocked, the proper supply to the affected area causes dysfunction and it manifests in the form of various symptoms. When blood supply to the brain is spilled into the brain because of rupture of the arteries, it is called hemorrhage. So there are two types of strokes: ischemic strokes and hemorrhagic strokes. Common causes are lifestyle diseases. As there is tremendous change in the eating habits of the young because of the deposition of cholesterol, triglycerides, the incidence of stroke is rising with the time. Ischemic strokes are usually because of diabetes, associated hypertension, dyslipidemia, where cholesterol, triglycerides, and other lipids are increased in the blood. Another culprit is cigarette smoking. Nicotine causes constriction of arteries, which leads to stroke. Besides some genetic preponderance, valvular dysfunctions or cardiac lesions are also responsible for causing ischemic strokes. Some vegetations or some cholesterol crystals get deposited on the walls and the heart throws emboli. Hypertension is another menace. Uncontrolled hypertension usually causes hardening of arteries, and when arteries break, it causes hemorrhage into the brain, and the amount of blood which is spilled in various parts of the brain causes havoc. Depending on the nutritional habits, young patients are affected more because of consumption of large amount of junk food, their sleeping habits, they are not doing proper exercises. Early symptoms of ischemic strokes are to be recognized because time is brain. If we recognize early symptoms, the studies have revealed that effective treatment is possible. Once the patient gets early symptoms like changes in the voice or called slurring of the speech, obscuration of vision or recurrent blackouts, or change in sensations over the face or one half of the body, or there is sudden weakness in any part of the body, patient should rush to emergency department. Here precaution is to be taken. Patient should visit a hospital which has facilities to diagnose early stroke. For example, in emergency, CT scan or MRI with diffusion weighted imaging can be done. And once the stroke is diagnosed, and if patient reaches within 4 hours of the onset of the attack, because of certain chemical injection, brain can be saved. So that's why it is called time is brain. So if patient improves because of these injections, then is all right. Otherwise, mechanical thrombectomy or embolectomy after doing proper DSA can be tried and patient can be saved. If patient improves from this stroke, then is good. Otherwise, patient needs rehabilitation in the forms of neurorehabilitation.